Hello, everyone, and thank you for joining this webinar. My topic for today will be the effects of laser acupuncture in patients with 12-year history of facial paralysis. It's a case report study. My name is Gil Ton. I am a Chinese medicine practitioner, lecturer, and researcher based in Amsterdam, the Netherlands. So let's begin. Outline for today's presentation, I will briefly talk about facial paralysis definition, and I will introduce to you the case report findings. So this paper was published in Complementary Therapies in Medicine journal in 2019. So if you are interested, you can search it and download it. It's an open access paper. So the human face, I think we all agree that it's unique for each individual, and it's a quite extremely actually important aspect of the person identity. So for one hand, the disease is not a life-threatening one. However, on the other hand, the human face is perhaps the most important region in the body. So therefore, if we can offer a treatment specifically for patients who have inadaptive recovery, I think we can contribute a lot to this topic. In terms of etiology of facial paralysis, it's quite varied. There are many factors that can cause facial paralysis. One of them is tumors along the way of the facial nerve, along the pathway of the facial nerve. Heterogenic factors like surgery, the TMJ surgery, viruses like varicocele zoster virus causing Ramsay-Hunt syndrome, or a viral otitis media, trauma due to car accidents and fractures of the temporal bone, idiopathic type, which known to be Bell's palsy, which is the most common cause of facial paralysis, and last but not least, and it's relevant for today's topic, central type facial paralysis coming from the central nervous system, from the brain, due to stroke. In terms of signs, usually we can see a droppy eyelid, dry eye or excessive tears, twitching of the facial muscles or weakness, and dropping corner of the mouth. In terms of symptoms, the patient usually will complain of facial muscle weakness, impaired taste and dry mouth, and posterior auricular pain. Usually on the acute phase, they will complain about this type of pain behind the ear, and this pain can last for weeks. Okay, overall, the prognosis of facial paralysis is quite good. Idiopathic type facial paralysis, Bell's palsy one, the prognosis is much better than the central type. In general, we can agree that about 20 to 30% of the patient will have inadaptive recovery. It won't be full recovery. And as consequences, obviously, it will cause physical and social impairments. And the medical options for this type of patients are quite limited. Commonly, we can see hemifacial spasm and voluntary or involuntary contractions of the facial muscles. Regarding Chinese medicine ability to treat Bell's palsy. So this is a review published by WHO in 2003. The first category, diseases that acupuncture have been proved through controlled clinical trials to be effective method. We can find facial pain. In the second category, which is diseases that therapeutic effect has been shown, but further proof is still needed, Bell's palsy is in this category. So there is still room for improvement in terms of our evidence. So let's talk specifically about this case study. This guy, 52 years old, retired, married plus 2 kids, came to the hospital in Taichung, where I did my PhD. and he was interested to join our clinical trial. We had a clinical trial about chronic type facial paralysis, chronic type Bell's palsy. Okay, and we excluded him. He cannot join the clinical trial because he was central type facial paralysis. However, as part of my work in the acupuncture department in China Medical University in Taiwan, we decided to treat him with the same protocol. So as you can see, he had severe left side facial paralysis, lasts for 12 years. He couldn't close his left eye, even in maximum effort, as you can see from picture B. His medical history, he had traumatic brain contusion following a car accident. He was hospitalized and was treated in the ICU. He was discharged from the hospital with hemiplegia, left side facial paralysis. He had speech and language deficit, and also left side hearing impairment. Okay, so he was badly injured. Okay, so we gave the patient a total of 30 laser acupuncture treatment sessions over 17 weeks. As you can see from table 1, it's a timeline table describing the treatment, his medication, the outcome assessments, basically describing all the important parameters of the treatment. Okay, the first 12 weeks, it was between 2 to 3 sessions per week. And then for 5 weeks, we gave the patient 1 session of acupuncture, of laser acupuncture for 5 weeks. Then we stopped the treatment, and the patient came back for a follow-up appointment after 1 month. So totally, we saw the patient for 5 months. Okay, the patient, when he had the car accident, when it all started 12 years ago, he was treated by Chinese medicine, mainly acupuncture treatment, Chinese herbal medicine. He was given physiotherapy and rehabilitation treatments. Okay, so the patient had a long history of treatments, and it didn't improve his facial paralysis complication. So the points we will use on the affected side, we use 7 local points, as you can see from the figure. The majority of them are Yang-Ming channel points. As well, we use Sanjiao 17. This is the area where the facial nerve is coming outside to the outer part of the face. We use bladder 2, gallbladder 14, and small intestine 18. In terms of the distal points, we use large intestine 4 and stomach 36. So bilateral. Large intestine 4 is the command point of the face, and stomach 36 was added due to its ability to tonify the qi of the Yang Ming, and it's good to use it in chronic condition. So regarding the results, the most significant and noticeable improvement during this laser acupuncture session was the patient's progressive ability to close his left eye. So as you can see from the figure, the difference between the 1st month and the 4th month, at the beginning when the patient arrived, he couldn't fully close his eye. And after the 10th session, there was a noticeable change in his ability to close the eye. After the 22nd session, he could fully close the eye, and he didn't receive any other treatments besides laser acupuncture. Moreover, his left eye had fewer shading and fewer tears, and he was no longer used his eye cover before he went to bed, before he was falling asleep. And he also reported an improvement of his facial muscles, giving him the ability to eat solid foods. Okay, he had drooling from the mouth, and that was also improved. And his family members noticed that his speaking ability was improved. He was speaking more clearly. So this figure you can see at the beginning of the treatment is left eye not able to be fully closed, and at the end of the treatment in picture B, you can see the results of this treatment. So regarding the physiological effect of low-level laser therapy, which is known to be LLLT and laser acupuncture treatment, we don't have time to talk a lot about it, but it's quite interesting to compare the effects of, and the easiest way to see it is through acupuncture analgesia, the effect of metal needle and light needle, and the effect on the tissue. But maybe in another time we will talk about this. So thank you so much for your listening. If you have any questions, you are welcome to contact me through the email below, and I wish you great success and all the best.